Afternoon, everyone. I am Dr. Simpiwe Siko, a South African doctor, and I am currently employed by the South African Military Health Services, where I work as a general medical practitioner. I'd like to thank you for viewing my channel and viewing this video. If you find this video useful, please like, subscribe, and share. Today's topic is clinical scoring systems that are used in acute appendicitis. They are also known as the clinical decision rules. So by the end of this video, I wish to have covered a few aspects such as who should be using these scoring systems, the challenges that are present with regards to the diagnostic workup of appendicitis, the advantages that are available by using clinical scoring systems. I'll also be leaving my recommendation by the end of this video, and also I'll also be leaving a few sources or a few links as to where people can go to find further reading. So I'd like to apologize. My presentation skills or presenting skills are not the best. So there's going to be some stuttering and some pausing throughout this video. So please do bear with me. So now, without wasting any more time, what are the challenges that are normally present in the diagnostic workup of acute appendicitis? First of all, the signs and symptoms of acute appendicitis are not that specific and exclusive to acute appendicitis only. They could be due to other intra-abdominal pathologies. This then results in a lengthy differential diagnosis. Also, there is a high negative appendectomy rate of 15%. Imaging modalities do try to reduce the negative appendectomy rate, but they do come with their own challenges and their own drawbacks. For example, ultrasound is highly operator dependent and has got a poor diagnostic accuracy. Also, another example is CT scan. It exposes the patient to high amounts of radiation, and also there are the challenges of the contrast that is used in conjunction with CT scans. And also, imaging modalities have got time delays to it, whether it is them being approved or also the conducting. This could then complicate an appendix to perforation. So now, to answer another question is, who should be using or who can use these scoring systems? They can be used by specialists or general medical practitioners. These scoring systems, I do wish that I could have known them very much earlier in my career. They would have made life more easy, or they would have made my approach to appendicitis more practical, because you do find that sometimes we are searching in our approach of appendicitis. So it is a skill set that a doctor should have, or rather, let me say, should form part of the skill set of general medical practitioners, not only for specialists but also general medical practitioners also. So now, what are the clinical scoring systems that are available? So we're going to be answering this question in a twofold manner. We're going to be looking at our adult population and also our pediatric population. There are four clinical scoring systems that are advised for the adult population, and there are two that are commonly advised for the pediatric patients. The four commonly recommended or referred to clinical systems in adults are as follows. They are the Appendicitis Inflammatory Response Score, Adult Appendicitis Score, RIPASA Score, and the commonly known and widely used Alvarado Score. So certain centers will prefer certain scoring system based on their own appreciation. In the pediatric patients, there are two scoring systems that are recommended: the Pediatric Appendicitis Score and the Alvarado Score. So now, how do they work? All these scoring systems have got three broad categories. These categories are the most common appendicitis symptoms, the most common appendicitis signs, and then the most commonly found appendicitis biochemical markers, or the most common laboratory tests in appendicitis. Of note, these scoring systems do not utilize imaging modalities to score patients and to risk stratify patients. So just to quickly recap, they use the most commonly known symptoms of acute appendicitis, the most commonly known signs of acute appendicitis, and they use biochemical markers. That is the most commonly used biochemical markers in the workup of acute appendicitis. So in these categories, there are sub-criteria that allows the doctor to allocate a point or 2 point depending on what the sub-criteria is, and then the doctor will then give a total score at the end of the scoring system. Once they combine all the points, this then helps them to stratify patients. As I've already mentioned, they do not use imaging modalities to score the patient. So now, after a patient has been given a score, after a patient who's presenting with acute appendicitis has been given a score, they then fall into one of three groups, or one of three classification or stratifications: low risk patients, intermediate risk patients, or high risk patients. Now, these risk stratifications will then help the doctor to decide as to which action they should take next. For example, it is advised that in low risk patients, there is no further imaging modalities that should be done, and the patient can be treated on outpatient basis. So a low risk patient does not need further imaging modalities, and this patient can be treated on outpatient care basis. So basically, what a low risk score says is that the probability that this patient has got appendicitis is low. So therefore, it rules out or excludes appendicitis. So now, intermediate risk patients. These are patients who need further imaging modalities to help the treating team to make a diagnosis of appendicitis. High risk patients, there's high probability of these patients having an appendicitis, and these patients, it is advised that in them they should not be receiving any further imaging investigation. These patients require urgent surgery. So now, what is the recommendation that I had promised at the beginning of the video? It is highly recommended that these clinical scoring system be used to achieve two things. First of all, they must help the doctor or the physician exclude acute appendicitis, and secondly, identify intermediate risk patient that may need further imaging modalities to help make the diagnosis. Now, what are the advantages of using these clinical scoring system? They help to avoid unnecessary hospital admissions. They avoid underusing and overusing of imaging modalities. They reduce negative surgical explorations. Now, also, as I have promised, there are certain articles that people can read to further appreciate this video. The first one is it's titled as follows: Diagnosis and Treatment of Acute Appendicitis, 2020 update of the WSES Jerusalem Guidelines, World Journal of Emergency Surgery. The second source that someone can look at is Acute Appendicitis, Efficient Diagnosis and Management by the American Academy of Family Physicians, 2018. Diagnosis and Management of Acute Appendicitis, EAES Consensus Development Conference of 2015. Surgical Endoscopy, the Surgical Endoscopy Journal. Once again, I would like to thank you for taking your time to watch this video. I hope it was educational. I hope it was educational to the point that you'll watch other videos that I will be having in the future. I do promise you that although this is my first video, it is definitely not my last video. So from a medical point of view, enjoy the rest of your Sunday. Thank you.